Hello, my name is Ian Hennessey and I'm a healthcare attorney with London Amburn. As a service to the members of the Knoxville Academy of Medicine, we will be providing regular updates on legal and regulatory developments potentially affecting physician practices in response to the COVID-19 pandemic. Today, we will be discussing two orders that were issued on March 23, 2020. The first order is Executive Order Number 18, which was issued by Tennessee Governor Bill Lee. The Executive Order 18 requires all hospitals, surgical outpatient facilities, and dental service providers to halt non-essential and elective procedures, including medical procedures that are not necessary to address a medical emergency or preserve the health and safety of a patient, as determined by a licensed medical provider. Examples provided of non-essential procedures include dental hygiene and dental cosmetic visits, bariatric and cosmetic surgery, and joint replacement surgery. Certain procedures are specifically exempted and may still be performed, like surgeries related to cardiovascular diseases that would prolong life, cancer testing and treatment, pregnancy-related visits including labor and delivery, organ transplantation, dialysis procedures, and emergency or trauma-related procedures. Additionally, Executive Order 18 calls upon all non-hospital healthcare providers impacted by Executive Order 18 to provide personal protective equipment, or PPE, in their possession to the Tennessee Emergency Management Agency by delivering it to the nearest Tennessee National Guard Armory. Examples of such equipment include medical gowns, N95 masks, surgical masks, Tyvek suits, boot covers, gloves, and eye protection not required for emergency care. Executive Order 18 went into effect at 12:01 a.m. March 24, 2020, and will remain in effect until 12:01 a.m. April 13, 2020. As of now, the plain language of Executive Order 18 only applies to hospitals, outpatient surgical facilities, and dental service providers. There is no mention in this order of restrictions on office space services or procedures by medical providers. The second order comes from the Knox County Health Department, which issued its Safer at Home order on March 23rd. The Safer at Home order requires all businesses not performing essential services to close their business facilities. However, the order does not apply to certain sectors and businesses and their employees deemed essential to protect the health and well-being of Knox County. Healthcare, mental and behavioral health, biomedical research, laboratory services, and other businesses that directly support the healthcare industry are specifically designated as essential services. Essential services providers are ordered to make best efforts to establish hours of operation during which their services will be available only to senior citizens or otherwise vulnerable populations. The Safer at Home order also requires all essential services providers to adhere to CDC guidelines on social distancing and hand hygiene in the workplace, including encouraging work from home and allowing employees, when possible, to work on site in shifts to optimize social distancing in the workplace. The COVID-19 pandemic and response is an evolving situation. All levels of government are engaged in the process of preparing new legislation, regulations, and orders to provide both guidance on stemming the spread of the virus and to provide relief to employers and employees. The updates provided in this video are subject to change. We will continue to monitor the situation and provide updates, especially as those updates affect healthcare providers and their practices. For more information on these topics and others affecting your practice, please visit our website at londonamburn.com or feel free to contact us at 865-637-0203. Thank you.